Hello friends, today I'll be talking to you about a very important topic, that is seizures disorder. So before I start my topic, let me tell you seizures, also known as epilepsy, also known as convulsion. Okay, so we'll be talking about these things. Are they same? The answer is no. They are not same. They are all different. So before I discuss why they're all different, let's learn the basic concepts. Basic concepts. If I ask you one question, we all know that in a living human being, electrical activity is going on in the brain. And what is the characteristic feature of the discharge in the brain? It is asynchronous discharge. So, in a normal person, brain has asynchronous discharge. That make a box of this line. Okay. So discharge in the brain is asynchronous. Now, if I say, what is the definition of seizures? Seizure is definition. A group of neuron, definition. A group of neuron they discharge in a synchronized way. Got it? So friend, in nutshell, what we can understand, in seizure disorder, there is disturbance of the electrical activity of the brain where a group of neurons, they discharge in a synchronized way. I repeat again. In seizure disorder, where there is a disturbance of the electrical activity of the brain, where a group of neurons, they discharge in a synchronized way. After that, put a comma. This is only half definition. The carry-home message till now is synchronized discharge by a group of neurons. The normal was asynchronous, and here we have synchronized discharge, and I asked you to put a comma. Now, for rest part of the definition, we have to learn some basic concept before I discuss the other part of the definition. So the basic concept still talk more. So in the basic concept, let's talk about brain. This is the brain, central sulcus. This is motor sulcus, sensory sulcus, area of social behavior and personality. This is the motor cortex, leg area, head area. This is the motor cortex. This is the sensory cortex, leg area, head area. This is the sensory cortex. And this is the area of social behavior and personality. An area of social behavior lies in the frontal lobe. Social behavior. And personality. This is the area. Got it? And of course, this is the occipital area. Occipital lobe, where area for vision. Here is the area of vision. This simply nutshell is a brief outline of the function of various parts of the brain. Now we were talking about disturbance of electrical activity of the brain. Suppose the disturbance occur here. This is the motor cortex of left side. This is the motor cortex of the left side in the head area. The disturbance in the motor cortex in the left head area, how he will manifest? Look at me. He will come like this. Why? All of you know that the motor cortex control contralateral body. He will like this thing. And suppose this disturbance move upward. So now, if you can see it, head and hand also. I hope you can see me. And later on, as it move upward, you can see, I don't think you can see my leg. Can you see my leg? Okay. Okay, I just show. Okay. So you are getting motor activity disturbed in the head, leg, and the hand and leg. And of course, this disturbance can go to other side of the motor cortex. The body will move like this thing. Suppose disturbance occurs in the sensory cortex. Sensory cortex. So he will have a sudden onset of numbness in the head area. And this numbness can spread otherwise. He will just complain some paresthesia numbness. Why? Disturbance lies in the sensory cortex. Suppose a disturbance occur in this motor, in the area of social behavior personality. I hope you know the function of this part, area of social behavior personality. We move in the society and we have to follow certain rules of society. Like you are wearing your routine dress right now. And later on when you go to sleep, you change the dress and you wear the night dress. Can you come to your workplace with a night dress? No way, no way. You can't come. Why? Because of area of social behavior, we have certain restriction. We have to follow the rules of society. Now suppose disturbance occur here. The patient suddenly loses all the inhibition. He uses bad language. He starts wearing bad clothes in the workplace, all because of disturbed electrical activity of the brain. Got it? So what I want to convey the message is, as per definition, there is a group of neurons that discharge in a synchronized way, comma. Now, this disturbed electrical activity may be in the motor cortex. The patient will have motor manifestation, sensory cortex, sensory manifestation, psychiatric manifestation. Depending on whichever the part is involved, the patient will have same manifestation. So now you continue with definition. You write down in front of the where you left the half definition after comma. So what I told you just now, that is seizure disorder. There is a disturbance of the electrical activity of the brain where a group of neurons they discharge in a synchronized way. Now you continue after that. So now the group of neurons they discharge in a synchronized way, comma. Now the patient may clinically manifest as motor, sensory, psychiatric, autonomic manifestation. This is seizures disorder. So a group of neurons they discharge in a synchronized way, and clinically they may manifest as motor, sensory, psychiatric, autonomic manifestation. This is seizure disorder. If it occurs repeatedly, then we call as epilepsy. Then we call it as epilepsy. And if the seizure disorder is accompanied by motor manifestation, only motor manifestation, then we call this as a convulsion. So friends, convulsion is a type of seizures, but all seizures may not be necessarily convulsion. Okay? So I hope you are clear about the definition of seizures disorder. Now, what are the causes of seizures disorder? The causes of seizure disorder are, it could be vascular. Causes of seizure disorder. It could be vascular. It could be, okay, idiopathic. Traumatic. Trauma. Autoimmune. Metabolic. Infection. This is 6 and 7 is neoplastic. Neoplastic. The mnemonic is vitamin. V I T A M I N. Mnemonic is vitamin. The entire causes is squeezed in only one word is vitamin. The causes of seizures disorder, vitamin. Okay. Now, what are the triggers factors? What are the factors which can trigger or we can precipitate seizures disorder? So, triggers are fever, head injury, loud music, so-called disco music, disco lights, strong lights, typically what we see in disco music and disco lights, sleep deprivation, emotional traumas, emotions, disturbance, okay, and of course a huge list is there, but they are the important factors which can triggers, and of course drug withdrawal is one more thing we can add. Drug withdrawals. Drug withdrawal means anti-epileptic drug. So anti-epileptic drug withdrawal is one of the important precipitating factor for these seizures. Okay. After that, we talk about types of seizures. Types of seizures. First is focal seizure, also known as partial seizures. Okay, for that we learn the basic concept: central sulcus, motor cortex, leg area, head area. So in the classification, first is focal, so-called partial seizure. In this, the disturbance in one focus in the brain. Let's talk about the disturbance in the left head area, left sided of head area. So how he will manifest? Like this thing. Look at me. So now we can see that he has got disturbance in the left head area, but the patient is conscious. Patient is conscious. So we call this as a simple partial seizure. Simple partial seizure. Seizure, as for seizure, simple partial seizure or simple focal seizure. The patient has localized problem, but patient is conscious. The main thing is patient is conscious. Now, suppose, then the second thing is complex partial seizure. Complex partial seizure. CPS stands for complex partial seizure. This is also known as temporal lobe epilepsy. Also known as temporal lobe epilepsy. Here, look at me again. Patient has focal seizure, but with that patient is unconscious. Patient is unconscious. So complex partial seizure is nothing but simple partial plus patient is unconscious. Point to be noted, here patient is conscious, here patient is unconscious. Otherwise, it's all localized disturbance, the way I demonstrated. Then we have secondary generalization. Secondary generalization. Here the disturbance starts in the head area. Suppose there is a left head area disturbance, he will have like this thing. Now disturbance move further. What we call as Jacksonian march. Jacksonian march. So as I did head area begin with, then hand area, and finally leg area. If you can see my leg, okay. Right, this is spreading to other part, we call as secondary generalization. And later on it can go to other part of body, the patient may have like this thing. Sometimes it happens so fast, it start as a focal but soon it become like, it apparently look that it is a generalized seizure. It apparently look is a generalized seizure. But what is the special thing in this which is not seen in generalized tonic-clonic? In this you get well-defined aura. You get well-defined aura. Well-defined aura. Well-defined aura, A-U-R-A. What do you mean by well-defined aura? Patient comes to know that he is going to have epilepsy. He may see some zigzag line. He may see some flashes in the eyes, or he may have something by which he will know that attack is about to occur. You can say aura is a type of advanced warning that I am patient, that patient, I'm about to get a seizure, is well-defined aura. So friend, in nutshell, in what all we have to remember, it's conscious, unconscious is complex. Here we have a Jacksonian march. What we have in complex partial, in what we have in secondary generalization. Now in partial seizure, especially now what else we can see in secondary generalization, especially you may get Toad's palsy. Toad's palsy. After the attack is over, patient might have some focal deficit, weakness of any part of the limb or body, what you call as Toad palsy, but it usually recovers within less than 24 hours. It recovers within 24 hours. What else is seen in partial seizure? Especially in, so you get deja vu phenomena. Deja vu phenomena. Deja vu phenomena. Deja vu phenomena is a unknown person looks very familiar. Is deja vu phenomena. Then we have one more, Jamia's view. Jamia's view. A known person looks very unfamiliar is Jamia's view. So friends, Toad palsy, deja vu, Jamia's view, and well-defined aura, what all we see in complex, in partial seizure, especially in secondary generalization. Then we talk about tonic-clonic seizures. Tonic-clonic seizures. Generalized GTCS, generalized tonic-clonic seizure. But before I proceed for this, partial seizures are never idiopathic. Write down, partial seizures are never idiopathic. They always have a structural problem in the brain in partial seizure. That's why CT MRI is mandatory in partial seizure. But generalized tonic-clonic seizure, they are usually idiopathic. They usually start suddenly with no aura or ill-defined aura. Ill-defined aura. Remember, in partial seizure, in generalized, secondary generalization, it was well-defined aura. Patient come to know that I'm going to have attack, but here we don't have. And it can occur in any position. Any position. Patient may be sitting, standing, sleeping, and there is sudden loss of consciousness. Sudden loss of consciousness. And if he's standing, he loses consciousness, he will fall. And as he will fall, he will likely to have sustained some injury if it is occurring in the standing position. Okay? Now, patient loses the consciousness. He falls. And after that, all body muscle, they go into contraction phase. Look at me, look at me. All body muscle, they go into contraction phase. And this is known as tonic phase. As the all body muscle are getting contracted, during that time, tongue bite can occur. Tongue bite. And if the tongue falls backward, it can lead to sudden respiratory arrest. Sudden respiratory arrest. Okay? And look at me, as the whole body is like this thing. Okay, it is there, like whole body is contracting, tonic phase. During that time only, if it persists for a long time, it can lead to hyperthermia. Hyperthermia, and it can even lead to muscle rhabdomyolysis, that is rhabdomyolysis can occur. All these problems can occur during the tonic phase of the muscle of the seizure. After some time, the muscle relax like this thing, clonic phase. Now we call as clonic phase. The tonic was muscle contraction, clonic is relaxation. Again, tonic, clonic seizures occur. Got it? So this occurs for about 15 to 20 minutes or half an hour. And during the tonic phase, patient may pass urine. Patient may pass stool. Why? Because all the muscle are contracting, abdominal muscle may contract, the patient may pass urine and stool, and there may be frothing in the mouth. Frothing in the mouth can occur. Okay? And as I told you, patient is unconscious, and once this tonic-clonic phase is over, patient remain unconscious for about half an hour or 1 hour. Gradually he regains consciousness. So regain of consciousness is gradual after half an hour, 1 hour. And patient may or may not remember what happened, so there may be amnesia. Amnesia means patient doesn't remember what happened during the attack. And after attack is over, patient headache may persist for a day or two. This is all what happened in generalized tonic-clonic seizure. Then we have absence seizures. Absence seizures. It classically occurs in children. It starts in early childhood. There is a transient loss of consciousness. Transient, only transient. Momentary loss of consciousness, but there is no postural fall. No postural fall. That means patient does not fall, which in contrast, in generalized tonic-clonic seizure, patient has loss of posture and patient falls. So there is a transient and patient has stoppage of. Patient stops for ongoing activity. Ongoing activity stop for a second. Ongoing activity stop for a moment, only moment, but regain consciousness immediately. Sometime in addition to, and it look that some daydreaming is going on. A daydreaming is going on in a child. Sometime the child may have to look at me, eyes, rapid blinking or rapid chewing movement for a second or so can be there. So rapid blinking or chewing movement can occur, but it occurs only for seconds. And these attacks may occur hundreds of times a day. And it may be first noticed by the school teacher, where they find child is not performing well in the class, not performing well in the class, and is first noticed by the usually the class teacher, because the class teacher in the school, they know the child very well. That is all absence is the and classically EEG is 3 hertz per second. 3 hertz per second is the classical ECG spike and wave pattern that we get in absence seizures. Then we have myoclonic seizures. Myoclonic seizures. It is shock-like movement of one limb, one half of body or the whole body. Look at me, whatever you can see. Look at me, look at my hand. Look at my hand. Suddenly, a shock-like activity in a limb, one half of body or the whole body is myoclonus. So it's a shock-like. Shock-like. Involvement of one limb, one half of the body or the whole body. It usually occurs soon after getting up in the morning. Usually occurs in children soon after getting up in the morning. But remember, this may occur in a normal person also. It may occur in a normal person. It's quite possible it must have happened with you also. Or it may happen in near future. In the morning you get up, suddenly you find a jhatka, a shock-like movement occurs. Then it is a myoclonus. Don't worry, don't get worried. It occurs in a normal person also. But I'm sure when it will happen with you in the next time, surely I'll come to your thoughts. Dr. Bhatia had told about this myoclonus, so nothing worry about it. Okay? But otherwise, it occurs in Creutzfeldt Jakob disease. Otherwise, myoclonic seizures as such are common in the younger children. Then we have one more thing which is seen only in pediatric age group, what we call as salam seizures. Salam seizures, also known as infantile spasm. Infantile spasm. Usually soon after birth, this is due to head injury or some obstetric injury, hypoxia. Look at me. There's a movement of head and this thing, torso and limb movement, what we call a salam seizure. And in this, in EEG, you got hips arrhythmia. Hips arrhythmia you get in EEG. Hips arrhythmia are seen in infantile spasm. More a topic of pediatric wala, but I just covered this point just to brief you what is infantile spasm. So friends, in nutshell, what we studied today is that seizure is a group of neurons that discharge in a synchronized way, and clinically it may be motor, sensory, it can be psychiatric, autonomic, and the precipitating the causes are vitamin, V for vascular, I for idiopathic, T for trauma, A for autoimmune, M for metabolic, I for infection, and N for neoplastic. Triggering are light sound, high sound, music, fever, sleep deprivation. And in the classification, we have a partial seizure, simple partial, patient conscious, a complex partial, patient unconscious, or secondary generalization. In generalized tonic-clonic seizure, patient has start suddenly in any position, start with tonic phase followed by clonic. Ultimately, this stops and patient remain unconscious, gradually regain conscious, headache persists. Then we discuss about absence seizure in children, daydreaming. We talk about myoclonus seizure, again in children, a shock-like sensation and infantile spasm, what happened in soon after birth or maybe in infants. Okay, so this was the classification of seizures, and now we know seizure, epilepsy, and convulsion are all different, right? So next time I'll be talking about the investigation, treatment, and about the seizure. In the meantime, if you want to, you can join me on my WhatsApp group. You can 99-682-888-32. You send your name, college of MBBS, which year you are, your email, and of course write Facebook. That means you are listening to me on Facebook. So name, college, year, which year you are, email, and MP. Send me detail. I'll be including in my WhatsApp group. I'll be sending you a lot of information on daily basis. And in the meantime, as you are directly connected with me, if you want to know or learn any specific topic, don't hesitate to send me a message. I'll be pakka including your topic. Previously, I have recorded many lectures which are there in YouTube. Must go see them and give the feedback. Okay, so see you with the part 2 seizures. Thank you very much for watching this video.